To understand the true source of massive corporate healthcare costs, we have to start at the desk of an employee. Data shows that catastrophic corporate healthcare costs rarely begin as sudden medical traumas or workplace accidents. These massive claims almost always originate as small, localized symptoms that an employee chooses not to treat immediately. This creates the expensive delay, a critical window where an employee decides to wait and guess rather than ask for professional help. The initial trigger for corporate financial bleed is the human choice to delay intervention. Employees don't ignore symptoms out of a desire to be sick. They are reacting to access friction, the systemic barriers like time, money, and logistics that penalize early medical intervention. When an employee feels unwell, they calculate the friction, the multi-day wait for an appointment, unpredictable consultation fees, and mandatory upfront copays. Faced with these immediate financial and logistical penalties, a rational adult will choose to wait and hope the symptom simply passes. This chart illustrates the behavioral outcome. As the friction to access care rises, the probability of early intervention drops. The current healthcare system incentivizes inaction, transforming a minor ailment into a compounding financial risk. The chronological escalation of an ignored symptom begins with several long days of reduced productivity and persistent physical discomfort. Eventually, the unmonitored condition worsens, forcing an emergency trip to an urgent care facility. This timeline tracks the financial mutation. The flat line, representing a minor symptom, spikes at the urgent care visit, which often results in specialized referrals, turning a minor issue into a complex, high-dollar insurance claim. When this pattern is repeated across an entire workforce, these individual curves aggregate into the massive block of corporate premium increases. Small barriers at the beginning of a health timeline create exponential costs at the end. To stop this massive financial snowball from rolling, access friction must be completely eliminated at the very top of the hill. Operogo acts as the technological conduit designed to bypass traditional healthcare barriers and connect employees directly to health. Through Operogo, employees gain direct access to the Paradigm Integrated Health and Wellness platform. The platform targets friction through 3 specific tools: 24/7 telehealth access, absolutely zero copays, and zero consultation fees. By removing the financial and logistical hurdles, the employee's mental calculation flips, encouraging immediate action. By successfully removing these initial barriers, the system transforms employee behavior from passive waiting into proactive health management. When the perspective shifts to the macro, organizational level, the impact on the bottom line becomes clear. This data visualization contrasts the two models. The old system relies on few early claims but faces massive catastrophic costs. The Operogo system shows a high volume of low-cost early interventions, which reduces catastrophic costs to near zero. The data shows that frictionless care leads to better overall access, which results in fewer avoidable medical escalations. This is structural cost control. Employers move beyond negotiating cheaper treatments to preventing the need for those treatments entirely. True savings come from neutralizing minor risks before they mutate into massive claims. Escalating corporate healthcare costs are a behavioral problem rooted in current incentive structures. While traditional systems punish early action, Operogo and the Paradigm platform reward it. Operogo uses mobile technology to alter human decision-making at the exact crucial moment a symptom first appears. The most effective way to support team health and protect the bottom line is to cure the expensive delay before it begins.